Are you having trouble getting plantar fasciitis to go away with your clients for the long term? It's a pretty sticky problem, and it may be that you're only focusing on the foot and ankle itself. There are a bunch of other muscle groups that we could include in your treatments that will actually give you way better long-term results. So let's get to it. So for plantar fasciitis, obviously that is going to be pain in this region here where the plantar fascia actually attaches. And we do want to do some direct work down here, but in large part the reason that this gets torn up is because of a lack of ankle movement up in here. And so in order to relieve it, we really want to think about relieving this entire area up here. Now, I'm not going to show the whole sequence that I do in our foot and ankle workshop, but I am going to at least show and talk about tibialis posterior, which I think is a very important muscle to release for this because it comes down deeply into here, crosses in, and then attaches all through the middle of the foot to the tarsals. And when it's stuck and no longer lifting the arch, the plantar fascia can get very easily overstretched. So that's going to be the basic goal that we're going to do today. Is we're going to do some easy broad work in here, and then we're going to work on tibialis posterior for sure, and the plantar fascia itself. So I'll start with the plantar fascia. I've got a nice easy position right now that I'm already sitting in, and we're going to draw 3 strokes, one on the inside arch, one on the outside arch, and there's also a transverse plantar fascia that goes across the toe bed right below the met head. So I can bring the flat of my forearm right above the heel into the arch itself and just lean in. And it seems like an odd thing to be using the elbow forearm on the foot, but honestly it doesn't have to be super deep. And I can just contact the inner arch and slowly melt through the fascia down here, all the way to the met head of the big toe. And then I can come up behind the outside arch, right above the heel, and this is a little bit more with the point of my elbow. Again, it does not have to, just because I'm using my elbow doesn't mean this has to be a lot of pressure. And in fact, a medium to light pressure with what you would feel like medium to light pressure for most clients will feel pretty deep in here. And last but not least, I'm going to come under the met heads and draw a stroke to the outside, right below the met heads with the point of my elbow. All right, and so those 3 strokes are really meant to kind of start to open up the plantar fascia itself and to get that a little bit more mobilized. For tibialis posterior, that is basically going to be the deepest muscle in the entire lower leg, attached to the tibia. And in order to get at it, we're going to have to lift all of the gastroc-soleus tissue out of the way, which you can do with one hand, and then come in right above the tibia on the edge of it. I'm going to use 2 fingers here. Sometimes I sit across and use a thumb. Certainly if somebody was in side lying position, this would be very easy to get into with an elbow, and if somebody's is very, very tight, I would do that. Mostly in this video, I just want to point out that if you're not working on tibialis posterior, you're not really going to help your plantar fascia clients much. So this is one way of many to get at this muscle. Now the other thing that I can be doing while I'm working on this is notice that now that I've really contacted it, and on a scale of 1 to 10, what does that actually feel like? Like a 9. All right, she's saying a 9, but she's acting like it's a 6. So notice that as I contacted it, this foot wants to invert. So what I can do here is use my other hand to try to shape the ankle and calcaneus into a more neutral position. This isn't the greatest body mechanics. I am actually having to use a lot of my pec muscles to provide force, so I don't want to do lots of this in work, but it's still highly effective, and I think it allows me to shape the feeling of the bones in the work. I said this in class just last week. We're releasing muscles to change positions of bones. That's what they're for. We're realigning the skeleton. So if you're not seeing a change in the shape of or positioning of a bone, then you're not really getting good myofascial release. So what we're looking for is that this calcaneus starts to come that way. I'll do one last stroke in here. And now I'm gonna have her start to do a little of the work. So what I'd like you to do, Anne, is gently flex your toes towards the pillow and lift more into the pinky side of your foot. Yes, great. And notice that that changes the position of her calcaneus to where it's much more neutral. And just let that go. Good. Okay. So we've worked directly on the plantar fascia, we've worked on tibialis posterior, which I would consider one of the main things that you need to make sure that you're getting done. We definitely have already created more ability for this foot to flex in the ankle joint. I'm not going to do all the detailed work I would do in the foot and ankle class, but I am just going to come down here and draw one broad stroke through the entire lower leg on the soleus side, so a little bit more lateral. And again, I can have her flex her foot into the pillow a little bit, lifting on the pinky side for her. Some clients you may actually have to have them lift on the big toe side, but for most clients they're a little bit inverted, and let that go. Great. And that already is starting to get a little bit more of a looser arch and a little bit more of a looser shape and a little bit more ankle hinge, which is going to take pressure off of the plantar fascia. I'm going to go ahead and repeat that on the other side just so that she doesn't walk in a circle instead of walking in a straight line. Okay, and I'm going to show tibialis posterior release like I did on the other side, but this time instead of sitting, I can come at it kneeling one knee down. This is a little bit easier on my body mechanics. And again, Anne, let me have you flex your foot towards the pillow and lift the pinky side. This side is really tight. Let it go. That's got to be zingy. Lift again. Let it go. Lift again. Let it go. Lift again. Let it go. Good. I'm going to do a couple more passes that way using different tools. From here, I can shape the foot just like I was doing from the stool. And again, because this body mechanics isn't as ideal as some other ways that I could do this, if I'm finding it really hard to get into the tissue, I could be doing this in side lying position. Nice. All right, last but not least, let's do this. So, again, I'm not going to show the detailed work of every little thing that we show in our foot and ankle 2-day workshop, but I can broadly come through here with a soft palm or forearm or soft fist and just try to open up soleus gastroc Let me have you, Anne, flex towards the pillow again. Let it go, and flex, and let go, and flex, and let go, and flex. Great. So we hope you got a lot out of this video and these techniques, and it really gave you some new ideas to work on your plantar fasciitis clients. If you would like to have some more advanced work, we have a 2-day workshop here in New York City, all on the foot and ankle, that it will definitely help clients with plantar fasciitis, but also a bunch of other foot and ankle related issues. It's worth 12 credits for New York State and any state that takes NCB-TMB credits for massage therapy continuing education. We offer it about twice a year, and you'll find links in the description below. If you like this video, please subscribe to our channel for future updates, and check this one out. We think you'll like it too.